Okay. Hi.
Hi.
It is really nice to speak to you. For those of you who don't know me, I am Marianne Trent and I'm a clinical psychologist. And today I have with me the lovely Melanie, and I will let you introduce yourself, Melanie.
So, hello everyone. I am Melanie Griffin and I am the Suicide Prevention Coordinator for Kaleidoscope Plus Group.
Lovely.
And let's talk a little bit, I think, about suicide.
Yeah. So, firstly, tell us a little bit about what Kaleidoscope Plus Group is.
So, we're a national charity and we provide support for mental health and also suicide prevention in part of that. My job role is the suicide prevention and the post-vention support. But as a whole, as a charity, we provide counselling, we provide in the community care and support, we will visit vulnerable people, and we also have a residential home for people who are struggling a little bit with their mental health as well.
That's so interesting. I didn't know you had a residential home. Is that for people just in Coventry, or is that people from across the country that could come to that?
It's based in Sandwell area.
Okay. So for local people around Sandwell?
Yes, through the that NHS trust.
Yeah, fantastic. So do you rely on charitable donations for your funding, or does it come from various different streams?
Various different streams. We receive majority of our money through obviously funding through grants and through contracts. We do also receive money through fundraising, and that's something that I think really a lot of people would be interested to sort of learn a little bit more about as we grow that around things like Christmas card donations. Rather than sending a Christmas card, you can set up kind of a Facebook fundraiser and raise money that way. But that's something that I think we need to, as a charity, we need to maybe grow a little bit this year.
Yeah. This year, surely no one wants Christmas cards, because like some people have been put in their posting quarantines. Like, this is an ideal time to kind of get on board with that, especially because suicides have gone up during lockdown, haven't they? So that would feel especially pertinent.
I think at the moment there's not actually any official data around suicides, and obviously the correlation between lockdown and suicides, have to be a little bit careful around it. However, mental health has obviously increased. About mental health conditions and people needing a little bit of support, that has increased during lockdown, and rightly so. I think we've all struggled a little bit with our mental health. I mean, I know myself, I'm a people person, and so to stay in the house and to not see anybody face to face and do everything via Zoom meetings, I found it tough, and I will hold my hands up and say it's not been the easiest. And I think for people who may have sort of pre-existing health conditions, it's been even tougher for them. And I think that's where we need to look out for each other and just check in with people.
For sure. And there's, if I'm working with people with body dysmorphia, we were just comparing routes, weren't we? Just before we shot the camera. I'm winning everybody. But for people with body dysmorphia, how they look and how they can appear to others is incredibly important. But at times when you can't get to salons and you can't do what you would usually do, it's going to lead to to even worse kind of mental health presentation for them. And young people especially, how you look can be so important. I mean, I know there's mental health's massive and there's lots of different reasons why people struggle, but certainly that's what I've observed with a couple of people that I work with in my clinical or my private practice or NHS practice. So our paths first crossed because Kaleidoscope had put together some videos. Could you tell us a little bit about that project and how that's been for you?
Yeah, to be working in suicide prevention, it's always been in the back of my mind that we need lived experience to share their experience around suicide. It's all well and good professionals, wanting to make the changes to suicide prevention, but it was to try and remember that there is a bereaved family at the core of the changes that we're making. So Kaleidoscope were lucky enough to team up with a charity called Lippy People, and they do short, sharp videos, about 3 to 5 minutes long, and they talk about the learning and the loss and the legacy. It's called the 4 L's: live, life, loss, legacy, I think it's called. Okay. And so we teamed up with them with the idea of people who've been bereaved by suicide to share their story in their own words around their loss, their experience, and what they have unfortunately through their journey learnt from their loved ones' death. So that was the idea behind it, and there was a lot of work behind the scenes, and we had meetings, and there was 6 in total, but in the end there's been 4 videos that have been released. And the videos are, as if anybody has watched them, is from that person who's speaking from the heart about their loved one, about what happened and what happened afterwards, and about their experience. So, for example, mine was about my sister. She was 13 and she was called Chelsea, and she took her own life. And it was about the initial phone call, what I did, as in straight away got in my car, drove back to where my family were from, and then I spent about the next 3.5 weeks living back in the family home with my fellow adult siblings, and it was what we did to get through and to process that initial shock and that grief. And then what has happened out of that is actually I've reconnected with some siblings that prior to my sister's death, life just got in the way. You know, people were at university, people were working, they've had children, but we actually reconnected. And through that now, I think as I have a better relationship with adult siblings. That was, for example, that's my video, but there were other videos. I know one of the ladies who was in the book, she also did she shared her story as well. And we wanted it so that the professionals, we could share them with professionals. They can use them as a learning tool for their projects, for their suicide prevention strategies, and to actually remember that the decisions that we make from a professional point of view, that there is a family and there is a bereaved person behind those decisions, and to try and keep it a little bit real. And that's where it came from.
Because I think, especially with, I work a lot with trauma, and obviously suicide would be a traumatic way to lose somebody, but it's almost like with any trauma, and with any death by trauma, but suicide especially, you've got multi-layers of grief, haven't you? So you've got like the normal grief underlying losing someone, but you've then also got to deal with the trauma or the suddenness of it, or you know, what you had to witness, and that's an added layer to grief, which can be so complex.
They always say that suicide grief is like grief with the volume turned up, and it's kind of a common phrase that's used.
I haven't heard that, but that's so powerful.
It like you say, there's the initial loss that everybody unfortunately has when they have been bereaved, but it's that whole the factor of they chose to do it to themselves that I think a lot of survivors struggle with. And there's always the if onlys, or if only I should I have done this, could I have done that, maybe if I'd have just rang them or popped round to see them, it would have changed the outcome. And the whys and the if onlys and the should have still last years down the line, that is part of the complex grief process and the journey that person has to live with. So it is very complex, and it takes quite a lot of time for people to work through their grief journey.
It does. It certainly does. Do you think that there's a difference in the way that somebody responds to the news? I've just lost my sister through suicide. Do you think there's a difference in how others respond to the news that it's by suicide? And do you think that affects how the person feels about sharing that and coping and recovering from that?
I think obviously everybody deals with any type of death completely differently, and the same, 2 people with suicide bereavements will be completely different. But I think we've still got, a society, we've got a lot to learn around suicide and around the stigma and the taboo. And sometimes as a family, you might be the only person that knows of a person who's died by suicide. So for example, in my experience, we didn't know anybody who'd been bereaved by suicide. So not only did we have a very public death because the media were involved, which didn't help to process that grief, we also then were the only ones in the community that had suicide, and it was very much a focus of people like, oh, do you know that family, they've lost so and so to suicide. But we need to talk about suicide more, and we need to make it a more normal subject, so that when you say I've lost so and so to suicide, the other person doesn't recoil back and think, oh,
Yeah.
God, I don't know what to do with this information.
Mm-hmm.
We need to be able to talk about suicide the same as we would if someone had died by cancer or road traffic accident or old age. We need to get that conversation started, because it's about talking about suicide that we can then make an impact. And by talking about your bereavement of suicide, then gets the conversation started with other people. And it was amazing after the fact how many community members kind of came to us privately and said, oh yes, I lost so and so 10 years ago to suicide, but I've never told anybody. So by having that conversation and getting the conversation started, more people then start talking about it and start to try and keep that community safe.
It reduces that stigma, doesn't it? And it gets that conversation out there. I was having exactly that conversation with somebody on the school run this morning when I said that I was going to be talking to you. And he was telling me about the barbershop collective. I think there might be another word in there that I've forgotten, but really powerful realization that with people visiting barbers regularly, not quite currently, but they, that people tend to talk on the barber's seat, and they're actually training people up who barbers to do basic counselling skills and to know how to signpost accordingly. And that seems incredibly powerful as an initiative to get mini counsellors everywhere in society, so that people don't go okie dokie, bye bye then, and run away with that and then do nothing with that. Because if you've really got yourself up to talk to somebody and hear, when you hear yourself say those words, that's incredibly powerful. If somebody goes, okay, so right, do you want a cup of tea, or like, are we finished? I've finished your haircut. Okay, off you go. But if you can know how to respond and have that be responded to compassionately and with purpose, that can potentially make a big difference.
Definitely. And I think that's the important thing, isn't it? It's not down to professionals to help everybody. We are a community. We're all in different areas. And I think that's vital, actually, that hairdressers and barbers and beauticians, we're at our most vulnerable sometimes when we're in the hairdressers or we're in the beauticians. And to actually have somebody you can have a conversation with that's you might be in the hairdressers 2-3 hours and start talking to them, and you can actually have a really engaging conversation with your client and not shy away from the subject, and actually, like you say, signpost, have some information, so that person thinks, oh, okay, I'm not the only one to necessarily struggle with this, because this hairdresser has some information, so she must have been able to, she or he must have helped somebody else previously.
Absolutely.
And that for me is important, that it's community led, that we need to make this difference to how we raise awareness around suicide. It's the schools, it's the the faith leaders, it's small community charities, hairdressers, like you said, barbers. It's everybody's business, and that's the most important thing. It's not necessarily down to someone who, like I say, works in the profession or someone who's been bereaved. It's also down to everybody, because the last thing I would want is for somebody to be bereaved. So actually learn how to spot the signs, learn how to start the conversation. There's some amazing training out there. We do training, but I would also say to everybody, give yourself 20 minutes, and there is the Zero Suicide Alliance, and it's a free 20-minute training session online, and it talks about spotting the signs, it talks about asking the questions. Everybody's got 20 minutes on a day to have, let's say in a day, you only need to do it once, but 20 minutes
in their life.
Take some time. You spend longer than that scrolling through your Facebook feed, so have a little look at that.
Okay, what I will do is when we finish this live, I will make sure that I post so that we can kind of promote that and encourage people to do that as a take-home message from this as well. And in terms of take-home messages, what advice would you give to somebody if someone tomorrow says to them, actually, I'm thinking of ending my life? What's the advice that Kaleidoscope would give for how to respond, and what's a best case practice for how to respond, Melanie?
The first thing I would say is stay calm. This person has entrusted their deepest, darkest feelings to you. So stay calm and let them do the talking. Yes, ask them questions, open-ended questions. Don't put words into their mouth, or don't try and close the conversation down and change the subject. We're talking about life or death here, so let's have the conversation around their feelings and why they want to end their own life. If you don't feel 100% comfortable, or you think I've got absolutely no idea what the hell to say here, there are helplines and there are text services that are available for that person. There are 24-hour services that you can contact or they can contact. Don't feel that you have to do it alone, but just be there for them. Keep checking in with them, ask them questions, make sure that they know that they can come to you and have those conversations when they are struggling with those thoughts. The thoughts may pass, they might come back, they might never come back. We don't know. It's based on an individual person basis, but just be there for them. And like I say, don't think at the end of the conversation, that's it, they're okay. Keep checking in with them. Make sure you've signposted them to organisations that can help, that they have got different avenues of support.
And I would absolutely agree with all of that. So some of our advice in the NHS is to highlight the importance of accident and emergency departments. So quite a lot of people that I work with don't realise that you can go there not just if you've got a leg hanging off, but if you feel like you can't keep yourself or someone else safe as well. It can be like a place of refuge to get properly assessed. So I would also add that you can liaise with crisis teams, and you can liaise with you take people to A&E or call 111 and discuss that with them as well.
And we are very lucky if you're watching and you are from Coventry or from the Warwickshire area, because we also have safe havens, and they act as that kind of halfway house so that people don't necessarily have to present to A&E as struggling with suicide. They can go to the safe havens, and we can put the information again on the news feed afterwards. But you can turn up to the safe havens, and there is a mental health professional there who will talk to you, talk about how you're feeling. If they need to do an intervention with you to help keep you safe there and then, they will also do that. So we are lucky that those services are there, and those services, the feedback is that they have actually saved lives. And I think that's really important as well, that people are aware that there are places to go and get support, and you are not alone. I think it's also important for people to be aware that when we are talking about suicide, if you ask the question, are you thinking about suicide? Are you thinking about killing yourself? Are you thinking about ending your own life? That there's research out there shows that by asking the question, you're not putting the idea into that person's head. So don't ever be afraid to ask the questions, are you thinking of suicide? Because the research is there that they're not going to then think, oh, I wasn't thinking of that, but that's a great idea or a solution. They will be thinking, okay, well, they've noticed a change in me, they've noticed this, and they're more likely then to say, yes, I am thinking of suicide. So
I think it's also important to think about when you ask that question, what's keeping you back from that. So thinking about, whilst I might be thinking about it, I don't actually have plans, but it's having those thoughts, having those dark thoughts about wanting to harm yourself can be scary, can be feel really derailing, but in terms of trying to work out someone's risk, it's important to work out what is keeping them from hurting themselves, because if that factor changed, then it would up their risk, wouldn't it, as well? I've just heard a ping. I don't know if that means we've had a question. Let's see if we have in fact got any questions or viewers. Let's have a look. I don't think I can watch on that, because if I click on that, it will.
Let me see if I can see anything on my phone.
It will start talking to me, and then I think I'll lose the sound for you. Radio silence for a moment. But I guess what's interesting is that I am an adult mental health clinician in Coventry, and I didn't know about the safe haven service that you mentioned, which is a bit of a worry, isn't it?
Yeah, I mean, I think there's definitely a need for more promotion of it. I know it has been shared out and about, but like you say, if you're in the field and you don't know about it, I think there's definitely maybe some work from the suicide prevention side in and around the region that we maybe need to improve the reach of the advertising of the services. And like I said, there is one, we've got one in Coventry, and there's also one in Warwickshire, so that it's available to anybody, that they actually they can access the support. Just trying to multitask, which isn't one.
Sorry, I think we've got some people watching, but we someone said hello everybody, but we haven't had any questions as such. But if you've got any questions, and if you've got any questions after this event, then feel free to comment, and I can pass those on to Melanie, or we can come up with a collaborative answer, can't we, Melanie? That would be great. So in terms of, we've done advice for how to respond. What would you say would be good advice if somebody is thinking that life is not worth living?
First of all, is your life is worth living. Your life is unique, and you are loved, and you are needed. So the thoughts in your head are not true. So first thing I would say is that we do want you to reach out and get some support and some help. Some people say, well, I don't want to burden my family. I don't want to tell my family about my thoughts. I would say to you, your family will want to know. They will want to be able to help you, and they will want you to get some support. But if you don't want to talk to your family about it, then that's when there are other services that are available. There is text services, and there are helplines. And like I said, we'll put together some text services and some helplines there, and actually reach out and get some support. The information that you give is confidential. So they're not going to disclose, say, for example, you're thinking of suicide and there is a reason, they're not going to then say, right, okay, well, I'm going to inform your family about this. It's confidential, and they will help you to get to the point of safety. And then they will also try and engage with you to, like, say, the crisis team or speaking to your doctor. There's lots of different avenues out there. It's just that you sometimes need to be really brave and take those first steps and seek some support. And that can sometimes be the hardest thing, of actually asking for some help. And that's why it's important, both sides, for the person who's thinking of suicide to ask for help, but also the family to spot that potentially there's a change in their loved one, to know that, okay, well, that's not usually how they behave, or they usually are maybe out and about visiting their friends, but they're now in their room, or they're not looking after themselves, or their language and the way they talk is different. So that between the two people, the person thinking of suicide and the people, the community, the carers of that person, are able to meet together and help keep that person safe. But ultimately, to the person who is thinking of suicide, speak to somebody you trust, that can help you help yourself and get some support. I think is really important. And to know that you're not alone. You're not the only person in the world who is thinking of suicide, and that there is help out there. You just need to take the first steps and ask for some help.
And yeah, absolutely. And that the way that you feel right now won't always be the way that you feel. And there can be time with the right person, with the right support, where you can feel different. And I know shame and guilt and jealousy and complex human emotions can get in the way of that. But, with the appropriate trauma treatment or the appropriate help and support, we can overcome and kind of process those thoughts and those feelings to move to a point where things just don't seem to matter as much as they might do before that treatment, before that help. So yeah, things can change. No matter what's going on, things can change.
And I think it's important as well to know that there's not just one avenue of help. If you try one route and you think, do you know what, this really isn't for me, there are other options. It's not just one route fits all, because sometimes we do hear stories, for example, or people share their stories and their experience that they may have told, I don't know, their friends, and their friends like, oh, it's just all in your head, snap out of it. Maybe they're not the right person to ask for some help then, but there will be somebody else that you can entrust to get that support, that go and then speak to your doctors, or like you say, there's the crisis team, there's the safe haven, there's helplines. There's lots of different avenues that people can try, and it's not a one size fits all, so there is different options available for you. You know what suits you, I know what suits me. So try different things. Don't just think, well, that didn't work, that's it, there isn't any further help. There's lots of different services, but it's just about knowing that to try different things, try and just take any help and support that is available for you.
Great, thank you. So how long did it take after your sister's passing? And I'm so sorry about your sister's passing, by the way. How long did it take until you found yourself working in the field, trying to make a difference?
So for me, what started it was about 6 months after she died that I reached my point of, I can't do this alone. I probably spent, it doesn't sound very good to say, but I probably spent about 3 months just drinking, sitting on the sofa, watching TV. My husband used to have to come in and force me to get out of my pajamas. He'd be like, "You've been in those pajamas 3 days, they've got spaghetti bolognese down them, go and have a shower." And after about 6 months of just that, I was like, I need some help. So I started researching and looking for support, and that's when I came across postvention suicide bereavement support. But there wasn't anything local, so I started going to it and driving. But I decided that that's when we needed something in and around the region. So 2 years after going for support, that's when we set up in Coventry, and we run a postvention support in and around the Coventry area. And we've been doing that since 2013, and then that's now expanded over time. So we have one in Warwickshire, we've got one in Coventry, we've got a couple in the Black Country, and it's to make sure that people are aware that they are around other people that have been bereaved by suicide, and there is help and support that we can signpost if someone needs some sleep support or some counselling. There's lots of different options that we can incorporate into the support package. But it's that peer-to-peer support, knowing you were around somebody else that's been bereaved by suicide. For me, I think I automatically relax now when I'm around someone who's been bereaved by suicide. I think I don't need to explain why I do things or how I do things. They understand that that's part of the process. So it's about 2 years after I'd been bereaved that I started to provide support, and now it's my full-time job and also voluntary job as well. So it's very much.
Sounds like you're doing really marvelous, very worthwhile things.
I'd like to think so, and I think it's just knowing that there's somebody there who's also going through it and is prepared to share their story. I think makes a difference to people as well.
Yeah, for sure. Let me just check if we've got any questions. I don't think we have. Thank you so much for your time, Melanie. And what I will do is we will get a link to put all of the things that we've mentioned, and we'll make sure that's in the feed after this. So if you haven't got any questions or anything else to say, what we'll do is we'll end this the live on Facebook, and then we'll just briefly finish up chatting to one another, if that suits you.
Yeah, no, that's fine. Yeah. We'll put the details in, as long as we'll make sure we put the 24-hour services in, so that if anybody's watching this evening or they want some support, but like I said, please do reach out and ask for some help, and reach in if you know someone who's struggling with thoughts of suicide. Reach in and ask the question, and just see how they're doing.
Yeah, and once you've sorted out any kind of fundraising things, if you want me to share on my social media, I'll be happy to.
Okay.
Very worthwhile cause. So thank you so much for your time. And like Melanie said, if you are struggling or you know somebody is, then do please reach out. Please do the 20-minute training that Melanie had mentioned, and we will post to that in this comment. But thank you so much for your time. I do hope you found this useful, and I look forward to catching up with you soon, which I'm sure Melanie will in the Kaleidoscope world as well.
Thank you, everybody.
Thank you very much. I'll end this. I'll end the feed. I think I can work out how to do that.